Ever wondered how prevalent herpes is around the globe? Well, the numbers might surprise you. Almost 2/3 of the global population under 50 years old, that's a staggering 3.7 billion people, are infected with herpes simplex virus type 1. This virus, known as HSV1, is the main cause of oral herpes. Moreover, an estimated 491 million people aged between 15 and 49, which equates to about 13% of people worldwide in this age group, are infected with herpes simplex virus type 2. This is the primary cause of genital herpes. Most of the time, herpes simplex virus infections are either asymptomatic or unrecognized. But when symptoms do occur, they include painful blisters or ulcers that can recur over time. Herpes is an infection caused by the herpes simplex virus. It is common and can cause painful blisters or ulcers. Although it is treatable, there is currently no cure for this infection. There are two types of herpes simplex virus. HSV1 mostly spreads by oral contact and causes infections in or around the mouth, often referred to as oral herpes or cold sores. The majority of adults are infected with HSV1. The second type, known as HSV2, spreads primarily by sexual contact and causes genital herpes. Often, people with herpes experience no symptoms or only mild symptoms. The infection can cause painful blisters or ulcers that can recur over time. While medicines can reduce symptoms, they cannot cure the infection. Recurrent symptoms of both oral and genital herpes can be distressing. Genital herpes can also carry a stigma and have an impact on sexual relationships. However, over time, most people with either kind of herpes adjust to living with the infection. Symptoms can include painful, recurring blisters or ulcers. New infections may cause fever, body aches, and swollen lymph nodes. Symptoms may be different during the first episode of infection than during a recurrent episode. Common symptoms of oral herpes include blisters or open sores in or around the mouth or lips. Genital herpes symptoms commonly include bumps, blisters, or open sores around the genitals or anus. These sores and blisters are typically painful, may break open, ooze, and then crust over. During their first infection, people may experience a fever, body aches, a sore throat in the case of oral herpes, headaches, and swollen lymph nodes near the infection site. People can have repeated outbreaks over time, which are usually shorter and less severe than the first outbreak. Medicines are often used to treat first or recurrent episodes of herpes. They can decrease how long symptoms last and how severe they are, but they can't cure the infection. Treatment for recurrent episodes is most effective when started within 48 hours of when symptoms begin. Antiviral medicines commonly given include acyclovir, famciclovir, and valacyclovir. Taking a lower daily dose of one of these medicines can also decrease the frequency of outbreaks. Treatment is often recommended for people who get very painful or frequent recurrent episodes or who want to lower the risk of giving herpes to someone else. In conclusion, herpes is a global health issue that affects billions of people. It's a common infection that can cause painful blisters or ulcers, and while it's treatable, there's currently no cure. The key to managing herpes is early treatment and understanding that it isn't the end of the world. Many people live with this infection and lead fulfilling lives. Remember, knowledge is power, and understanding herpes is the first step in managing it effectively.